This is a short film just to describe the journey that Preparing for Adulthood's been on in terms of learning about how to develop good education healthcare plans that help young people prepare for the future and get the right support to achieve the life outcomes that are in the Green Paper of paid employment, independent living, good health and community inclusion, friends and relationships. So the first thing that we did was we actually worked with early support to develop a template for a 0 to 25 plan, and we really built that on best practice in person-centred support planning. That was what we were trying to do, and that was a good plan because it kind of looked at 0 to 25. And what we've been doing with Preparing for Adulthood is testing that plan out with the Pathfinders, so trying to refine this and see what this tells us about how it really helps people prepare for the future and get the right support. So we did that by testing the early support, the plan we did with early support, particularly in Manchester and Darlington, and we got together at the end of last year to review with them what had they learned, and there were a number of things that came out of things that they thought needed to be in the plan and needed to be considered for it really to have a forward focus and make sure that it actually helped young people have better outcomes. So Manchester and Darlington went off and tested that. A number of other Pathfinders tested that and very similar looking plans. And what we've been doing today is hearing from them about what's working, what's not working about the plan. The other thing that we've been doing in the meantime is we've actually been talking to people who work on tribunals to see what needs to be in the plan to make sure that it fulfills the statutory purposes that it will need to do. We've also been talking to a range of commissioners and providers across education, health and social care to see whether it helps them plan good provision for the future. So we've been talking to various colleges in the sites, and we've been talking to personal health budgets commissioners, we've been talking to adult social care commissioners, and just saying, would this help you plan future provision and support? So today we've heard from those Pathfinders about what we're doing. We're really excited about the stuff that they've been telling us. We've got some nice stories that we'll put on the website that explain their journey and how they're working with young people, families, and all the key agencies like schools, colleges, ISPs, everyone to try and develop these plans, and adult social care, etc. And the really positive stuff that we've heard is that we're broadly on the right track. I think we've heard from 4 Pathfinders today, and there are some common headings that are very helpful. And so we're going to be building on those, and Manchester and Darlington are going to be refining this and testing out their version 3. And then but really what we're starting to think about now is what are the implications for implementation. A really key theme today is how do you embed in the system good planners for developing these plans with young people and families. There's a number of competencies that have come out and a number of skills that people will need. So we're going to be sort of developing that learning. So when we're thinking about implementation, one of the things we're going to need to think about is what processes and systems we might put in that pathway into journey into adulthood that will help generate the information that's required for an education healthcare plan. And one of the things we're looking at is the role that person-centred reviews can play in that. So we know that statutory transition reviews are really, really important. We're building on the good practice that's happened in previous programmes around person-centred transition planning and the role that person-centred reviews can play in that. And we'll be looking at how that information, if they're done well, can help can generate information for an education healthcare plan and help people plan ahead. The other thing that we're going to be doing is talking in more detail with other people who need to input to 0 to 25 plans and need to be able to use those plans to help deliver good support for people. So Linda, one of our colleagues, is going to be talking to the ELSIS clusters. ELSIS is funded by BIS, this piece of work, and their phase 2 for ELSIS is bringing together FE colleges and ISPs and other agencies to help look at how they develop good programmes of study that lead to the key outcomes in the green paper. Linda's going to be sharing what we've learned about the single plan so far with them and getting feedback from them really as providers to whether this would help them identify whether they could support somebody, and if so, how well, and how would they design programmes of study from that. So that's really exciting. We'll continue to talk to the personal health budgets team and to our adult social care colleagues, and start to look at processes for how you could use education healthcare plans to inform commissioning and provision, and use those well in advance so that people have the right support to move into adulthood with paid employment, good health, community inclusion and independent living.